and welcome back. Today's hot topic is going to be tick bites. We always see an uptick in cases as we get into the spring and summer months, so it's good to be armed with knowledge before you head out on your camping or hiking trips. Why do we care about tick bites? First of all, ticks eat our blood, which is gross. If that weren't enough, they also can be a significant carrier of Rocky Mountain spotted fever, Lyme disease, ehrlichiosis, among other what we classify as rickettsial or tick-borne diseases. These can be a significant impact on the life of the person who they happen to, so avoidance is key. How do we avoid getting tick bites? Good question, and I'm glad you asked. Number one is keep as much of your body covered as possible. Ticks don't bite through fabric, so a lot of people will wear socks over their leggings or pants, tuck their pants cuffs down into those. Wearing longer, tight-fitting sleeves is good, and keeping as much of your skin covered as possible. Another thing we can do is bug repellents. Again, there are a lot of different kinds out there. DEET is the most effective, and the higher concentration, the better protection you're going to have. It really just depends on how long you're going to be out and the density of the vegetation where you're going to be. If you're going to be in thick brush, in weeds, or underneath trees, you really need to be mindful of that. Keep in mind, if you're going to be applying sunscreen and DEET spray, that they can interact with each other and make each other less effective. So you may need to use a higher SPF or reapply more often. I had a comparison of some of the different kinds of bug repellents in my mosquito bite video, so you can watch that for more information. What happens if I do get bitten? Well, as soon as you find the tick, remove it as quickly as possible. The longer the tick bite, the higher the likelihood of getting an infection. So, as soon as you come in from your outdoor activity, get in the shower, because you need to rinse off the DEET and the sunscreen anyway. Check your body, check your scalp, check the unmentionable areas, because ticks like to go there because they're nice and warm and protected.
We don't do that here.
How do we remove a tick? There are a lot of different ways. The two most effective I have found, I'm going to show you. One is this neat little invention called the Tick Tornado. It's pretty cool. There's also a smaller one that comes in the package with it. They kind of look like tiny little king cobras. But what happens is there's a little V here. You slide this over the body of the tick. So just imagine this is the skin where the tick bite is. You slide that right over and then twist and twist and twist. And then eventually the tick can't hold on any longer and lets go. I've tried this on a couple of my patients. They did have some discomfort when we were twisting because the tick was trying to stay bitten. Most of the time people don't feel a tick bite because the venom that the tick injects is actually an anesthetic, so you don't feel it. So until you start to remove it, you don't feel anything. The other way that I've found that's very effective and pretty easy, and it gets the whole thing out including the head, is get a little round piece of cotton, whether that's a cotton ball or the cotton pad like you remove your makeup with, and get a glob of liquid soap. Everybody's got that around, or body wash or something along those lines, about that amount of viscosity. Hold it over the tick for about a minute. That will start to smother the tick and it will let go. And then you just grab it either with your fingers. I think ticks are gross, so I use tweezers and just grab it as close to the skin as you can, and it should just pull right out. What happens if the head stays in? Don't worry about it. It may itch a little bit, and it may stay in for weeks or maybe even months, but eventually your body will get rid of it. So if it bothers you, I have patients that pick at them all the time. It can get a scab and get a little bit irritated, but it's not dangerous for the head to stay embedded. Patients often ask me immediately after they remove a tick, should I go on antibiotics? I'm not feeling very good. What should I do? Generally, it takes 7 to 10 days, sometimes up to 14, for people to start developing symptoms of one of the tick-borne illnesses. And so I generally tell them right afterwards, just keep an eye on it. The vast majority of these bites don't lead to anything other than maybe a little bit of discomfort. Sometimes people will break out in a little rash right around it that looks kind of like chicken pox almost. It'll get bubbly. That's an allergic reaction to the venom. That generally goes away on its own. You can put cold compresses on there or maybe some hydrocortisone ointment. Then if it's in the 7 to 10 day range and someone starts developing symptoms of that target rash that we would expect to see with Lyme disease called erythema chronica migrans, and it doesn't have to be exactly where the tick bite was either. Sometimes it's tricky. That, or with Rocky Mountain spotted fever, we will sometimes see a rash on the palms of the hands or the soles of the feet, a rash on other parts of your body too. Fever, chills, body aches, muscle pains, fatigue, feeling sick in the summer when you usually haven't had exposure to people who are sick with flu or other things, we start thinking about tick-borne diseases. I've diagnosed several different cases where people didn't know of a particular tick bite because they didn't feel anything, and then we checked them and they were positive for this. So as a doctor, we always keep that in mind, especially in the spring and summer months. The key to infections like Lyme disease and Rocky Mountain spotted fever, among the others, is early detection and treatment. We use antibiotics just like we do for many other infections, and it can be treated very effectively. Many people wind up not needing to be hospitalized or having more serious complications. So use your bug protection, check yourself right when you get indoors, and if you start feeling bad, talk to your doctor.
Get some help.
Let's stay healthy this summer. Like and subscribe and keep tuning in.